and welcome to this brief demonstration video about the Mental Health app. For the next few minutes, I'd like to show you what the app includes and how you can use it in your classroom or clinical setting. The Mental Health app is designed to be a reference tool to support focused coursework, instruction, and clinical experiences in this area. Briefly, the app is a readily available clinician's pocket guide to common mental health conditions and the rehabilitation considerations. It was collaboratively built by a team of professionals consisting of a psychologist and a number of rehab specialists. To begin, access the app from the main page of the web suite by clicking on Mental Health. Once in the app, you'll notice that it is organized by 7 categories of disorders, including depressive disorders, anxiety disorders, bipolar and related disorders, schizophrenia spectrum disorders, obsessive compulsive disorders, trauma and stressor related disorders, and feeding and eating disorders. To learn more about a specific disorder, simply click on the category you are interested in to view all the disorders in that category. For example, if we click on anxiety disorders, you will see that there are 3 disorders in this category: generalized anxiety disorder, panic disorder, and phobia. Let's use generalized anxiety disorder as our example today. For each disorder in the app, there are the same 5 subcategories listed, which provide the following. The first begins with the background and basic diagnostic criteria of the disorder from the 5th edition of the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5. Next is the prevalence of the disorder in the United States, in other countries, and age and lifespan differences, if they exist. Next are the functional consequences, which is how a patient might present with the disorder and how the patient's biopsychosocial function would be impacted by the disorder. Next are the applications in rehabilitation. First, we are presented with a list of screening tools, which is used to assess the patient for the disorder. Each of these tools includes the psychometric properties of the tool, and it is always evidence-based and referenced. It includes a link to the tool, for example, the Beck Anxiety Inventory, including a link to the tool as a PDF. The next application in rehabilitation are the therapeutic techniques. This is a list of suggested techniques that may be used to help the patient manage the condition, but it is in no way prescriptive. The next application in rehabilitation are the precautions. This is a list of signs and symptoms and comorbidities to take note and take into consideration when designing or modifying the rehabilitation process. The final application in rehabilitation is movement-based management. This is a list of how effective exercise may be and suggestions for prescribing exercise for the patient. The final section under each disorder are the common medications used to treat the disorder. Each of these medications is linked to the pharmacology app within the suite. Each of the links will open in a new browser tab, so you won't lose your place in the app that you are looking at. Thank you for joining me for this brief walkthrough of the features of the Mental Health app, which can be used by faculty to prepare students to appropriately adapt the rehabilitation process to meet the diverse needs of clients. Check out the new Mental Health app and elevate your teaching and clinical practice today.